Andy Slavitt. He is a former Obama official who worked on Medicaid, Medicare, health insurance, all related things in the Obama administration. Andy, thank you so much for joining me on the Thom Hartmann Program today.
Good to be here. Thanks for having me.
So Republicans in Congress, it looks like, aren't quite ready to say that they're done trying to repeal the Affordable Care Act. We're actually watching them this week try to throw one last Hail Mary pass, or at least that's how it appears, trying to repeal the ACA and also potentially make huge cuts to Medicaid. What are they up to, and do we think it's going to have any chances of succeeding?
Well, I was talking to one of them actually this morning. They have 16 days left in order to be able to pass a fully partisan bill, which is 50 votes. They are working hard to try to make that a priority. In order to do that, they need Leader McConnell to agree to give them some floor time, and they need President Trump to make this a priority. So I would say for anybody who thinks repeal and replace is over, it's not. There is a tremendous amount of work that still has to be done. A lot of things can happen over the next 2 weeks. It's a busy calendar. And, I would also say even if it doesn't happen in the next 2 weeks, remember the last vote was very, very close. And both houses of Congress and the White House, of course, are still occupied by a party that really wants to repeal and replace the law. So no reason to take anybody's eye off the ball.
So part of the reason I describe this as one last Hail Mary pass or an attempt at it, we'll get to see if they are actually able to complete it, to continue a very tired football metaphor, is because the clock is ticking on what's known as reconciliation instructions. These are the fast-track procedural powers that Republicans have been seeking to use to ram through repeal of the ACA and also, in some versions of their proposals, huge cuts to Medicaid without a single Democratic vote. And there's a time limit on how long those instructions, those fast-track powers, actually are good for, and they're set to expire at the end of the month. Some people are saying that might not even give the Congressional Budget Office, CBO, enough time to score the bill.
Well, I wouldn't count on that. I think, the CBO has apparently had the bill for a week. It's a tough bill to score for a variety of reasons, so it's not an easy job. But you're absolutely right. Once they get done with that, they still have to go through what's known as the Byrd Rule, which is to make sure that everything that's in the legislation can pass, and then they have to get it on the floor of the Senate. So they don't have a lot of time. But I will say this. And this is a very important and kind of a subtle point. Because their reconciliation instructions expire, that means that after September 30th, they won't be able to take anything back from the House should this go to the House. And why that's important is it means that if this goes to the House after getting out of the Senate, the House will have to look at it on a take it or leave it basis. And that's always dangerous because that means that people who don't like it are going to only have two choices, sign on or don't. And generally speaking, most people in the House believe that they would sign it. So it's not right, I think, to count anybody's chickens just yet.
So what happens if they aren't able to pass anything before the end of the month? Do you think that there's a chance that they may actually try to use the budget proposal that they are saying that they want to pass so that they can do what they're calling tax reform, as we were discussing earlier in the show today? Do you think that they might try to use that budget proposal to set new reconciliation instructions to give themselves some extra time?
Well, I think putting health and tax together takes an already complex and difficult thing and makes it more complex and difficult. I do think that the Congress, a lot of people in the Congress, both sides of the aisle, that really want to move on from health care and put it as far behind them as possible. It really does hog their agenda, and there's a lot of other things to take on. Having said that, if they end up with 50 votes because of something that happens in any one of a number of states, including New Jersey or Arizona or anywhere else, that could change the entire strategy and outlook. So, look, if you're not a favor of repealing and replacing the ACA, then I think until one of the houses of Congress changes or the White House changes, you've got reason to be very nervous.
Now, meanwhile, as we were talking about earlier in the show, we actually had new data out from the Census Bureau this week that didn't just look at the poverty rate in the country, which now has actually reached pre-recession levels for the first time since the recession. Good news there. Also showed incomes up. We were talking a lot about that in the first hour, but it also showed that the rate of Americans, the share of Americans who don't have health insurance in this country has now reached record lows. We're now down at 8.8% of Americans who don't have health insurance. And that's obviously a story about the Affordable Care Act and also Medicaid expansion, showing how much is at stake if the Affordable Care Act is actually repealed.
You know, it's really great that you bring that up. When there was a time when I was talking with Secretary Burwell, who was the Human Services Secretary, who served alongside me for President Obama, and you know, we were just having a conversation, and one of us said to the other, "Wouldn't it be amazing if this president can leave office with an uninsured rate under 10%?" And at that point, you know, we'd seen it go down. It had been 16% for, 20, 30 years running. It was down to 12. It was down to 11. And it seemed like the idea of even being able to say that 9 out of 10 Americans were no longer at risk of bankruptcy from a medical bill or had access to a regular source of care would just be an amazing milestone. So to see that today, I hope that people don't take it for granted, or I hope that people that are just on the scene lately realize what an enormous set of progress that is for our country, and we ought to be very proud of that.
So, meanwhile, on the far opposite side of the political spectrum, this week we actually saw Senator Bernie Sanders unveil legislation that he's calling Medicare for All. It's his way of trying to move forward the conversation on universal health insurance. And he actually did draw record support from Democrats, a tremendous amount of co-sponsors in the Senate with him. There's a House piece of legislation that's a companion that has lots of co-sponsors as well. I have to say, it was hard for me to watch this unfold this week without thinking back to the 2008 presidential primary, the Democratic primary, when Dennis Kucinich, who was running that year, was sort of on stage, always at the end, always off on the end, in his kind of oversized, ill-fitting suit and shaking his fist going, Medicare for all. And of course, no one was taking him seriously. But now we're actually seeing this grow in support and become not maybe a mainstream Democratic idea, but something that's certainly gaining support throughout the caucus. What's your take on that bill and what we're seeing in terms of universal health coverage and even perhaps Medicare for all starting to become a more mainstream idea?
And what is it with liberals and ill-fitting suits? You should do a program on that.
Well, it's not just liberals. I mean, take a look at Trump.
Well, how about that? Ill-fitting suits, liberals versus conservatives. I think it would make a great show. So I think, first of all, congratulations to Senator Sanders for putting forward a bill that really has at its heart a simple vision. Every American gets a card at birth, and we no longer have to worry about medical expenses again. Now, so even before we start getting into the parade of issues and concerns of which and challenges of which we know there are many, including politically entrenched interests, and the fact that you've got people who have employer-based coverage that would have to give that up, and the fact that that there's a serious conversation required about how to pay for this. Big things happen when people lay out a marker and lay out a vision, and that's good. And even better news, this isn't the only vision coming out. I think over the next week we're going to see Senator Brian Schatz have a bill come out which moves toward universal coverage with an option for all Americans to buy into Medicaid. Chris Murphy is going to have a bill out around buying into Medicare earlier. And I'm aware of 3 or 4 others not yet unannounced bills that are variations of the theme. And to my mind, at this point, my opinion is the more of these, the better, and the earlier, the better, because rather than putting a piece of legislation out there and without any time for it to be vetted by the American public and for people to understand it and debate the trade-offs, because there indeed are trade-offs, it's really useful to have these things out there. Now, I think ultimately we should be striving to look for the ideas that can capture the imagination of 60 to 70% of the American public that have the ability to sustain themselves that we can get some demonstration that we know can work, and that address the serious issues and needs in this country, like the people who are most vulnerable, low income, and have low access to health care. It's not an easy task, but to your point, we are at a place where we finally will have a set of ideas out there that the American public can look at and debate, and that's a good step.
Well, and I have to say, thinking about that progression from Kucinich and the shaking fist and ill-fitting suit to today, with this actually being something that people are taking much more seriously, even though this bill, as you mentioned, obviously isn't going to pass in this Congress. I have to say it also brings to mind what we've seen in terms of the evolution on the debate around Social Security. It wasn't that long ago that there were definitely folks in both parties and really across the political spectrum who were taking seriously the idea of cutting Social Security and even talking about it as though it was some kind of fiscal imperative. We've now reached a point where it is the not just mainstream but consensus view of the entire Democratic Party, not to mention the entire progressive movement, that what we need to be doing is not just not cutting Social Security, but actually expanding it. So really amazing to watch the evolution of this debate.